How you doing, right?
Good.
Probably a little busier than you thought you'd be when you took this job.
There's that go.
Hello, and welcome to the USA Today Network. I'm John McAlpin, and today my colleague Ashley Balcerzak and I welcome Governor Phil Murphy of New Jersey and Governor John Carney of Delaware, two governors who have been up to now managing the coronavirus crisis, and now they look cautiously to reopening their states. Hanging over that decision is warning from public health officials that reopening too quickly could mean the outbreak returns, an outbreak that's already killed tens of thousands of Americans. Governors, today we have top questions from our audience about that reopening, your decisions to do that, as well as more questions about the impact of the coronavirus lockdown. And today, Governor Murphy, you announced testing and contact tracing steps and goals for New Jersey. How do those measures you announced today inform your reopening plan going forward?
First of all, John and Ashley, thank you for having me back on. I've enjoyed our doing this in the past, and I'm incredibly honored to be on with John Carney, who I consider a friend, an outstanding leader. And as part of the regional council, Delaware and New Jersey are part of the 7 states that sort of exchanged best practices informally, but regularly as we closed our states, and are now very much actively coordinating as we take steps to responsibly reopen. So we have a 6-part plan, our road to recovery. And 4 of those 6 steps are healthcare related. And 2 of the ones, John, that you asked about, we touched today. So the first one is we need the progress to continue. And we've lost 9,508 blessed New Jersey souls. But the hospitalizations, ICU beds, ventilators, the heat maps, there's a lot of signs that are positive. We need those curves to continue to be positive. We then need a robust, scaled up testing protocol. We committed to having at least 20,000 tests per day by the end of this month, 25,000 by the end of June. We think that puts us in a position to not just test vulnerable communities and frontline workers, like healthcare workers and others, but also in the general population. We also discussed contact tracing, the notion of hiring community folks up and down the state in coordination with technology, so we could quickly snuff out any reemergence. And the next and last healthcare step, which we didn't spend a lot of time today, is on isolation. The short part of this is if we had that healthcare infrastructure in place, which we will, that gives not just us confidence, but hopefully gives folks in the state confidence that they can themselves participate in the reopening, that they can go to the beach or a county park or more actively participate. And that's just what we want, both a healthcare recovery and an economic recovery.
Got it. Governor Carney, you have announced that certain businesses in Delaware can reopen with strict social distancing measures and other precautions in place. Can you talk to us a bit about how you made that decision, what informed the certain businesses and what informed the social distancing measures?
Yeah, first of all, let me thank you for the opportunity to join my friend, Governor Murphy, on the program tonight. We've been communicating over the last several weeks as we both have gone through this experience together. It's an unprecedented thing in our history. None of us were around in 1918 with the flu pandemic there, and there's no real. We're in uncharted territory each and every day, and so to have a friend like Governor Murphy that I can reach out to, Governor Wolf over in Pennsylvania, and Governor Hogan on our other border to the south, has just been comforting and helpful. Of course, our hearts go out to the Metro New York area and the folks that have been hit so difficult. Both Governor Cuomo and Governor Murphy have done a great job. I've been fortunate here in that the wave kind of started there in Metro New York, and we were kind of a week or two behind, so we could watch the way Governor Murphy, Governor Cuomo responded to the situation on the ground, to listen to what was driving them. I think each of us focused on the CDC guidelines and the White House task force, which was part of a weekly conference call that we had. And Governor Murphy has been prominently featured there as somebody called on to talk about what's happening in the state of New Jersey. We joined, as Governor Murphy referred to, the regional collaboration, which for us is a really good thing. We get the expertise of our neighbors to the north of us, who have gone through this a little bit before us. We get both their expertise, their purchasing power, and it's been a very positive thing for us. We've looked at the same criteria that Governor Murphy referred to, an improving community health situation where we have reducing our positive cases going down, percent positive cases on a day-to-day basis, that our hospitalization rates are on the decline, and the deaths, although a very lagging indicator, terrible indicator, but a lagging one, declining as well. Use that as a measure as to when we can start to open things up here, working with various sectors of the business community in Delaware, which is a very small community with just a million people here, south of Pennsylvania and New Jersey. And so we identified businesses that were very much like essential businesses that were already open, to find ways that they could operate as long as their customers came in and observed social distancing, wore masks, appropriate demarcations on the floor in the retail establishments, and just reinforce those principles that have guided us through this, that in order to flatten the curve, to prevent the spread from areas and communities in our state, we needed to reduce the social interaction among people. And that's what all these guidelines are intended to do, and the restrictions that we're putting on our businesses as we slowly reopen the economy. We like to think of it as a rolling reopening, as opposed, I've heard Governor Murphy refer to it as just flicking a light switch. It's not a just flick the light switch from off to on. It's more like a dimmer switch, gradually allowing businesses to come online and to do so in a safe way with appropriate social distancing, mask wearing, and the like.
Got it. Each of you is governor in a state with a coastline that's very important to not just the economy, but the culture of the state as well. And it's hard to even think about Memorial Day and going with the beaches. But governors, I'd like to ask each of you, about opening the beaches as well. And we all know that there's a world of difference between just going on the beach and going down the shore. Down the shore means boardwalks, restaurants, in line for ice cream, all of that. Can Governor Murphy or Governor Carney, can you talk to us about the decisions to open up the shore areas, in particular, the pressure you're seeing and some of the concerns you have? Governor Murphy?
Yeah, John, thank you. In fact, Governor Carney and I spoke earlier today about this. Our teams are on the phone tonight. Let me say that we don't act in lockstep because each state has its own uniqueness. In fact, in New Jersey, I just got off a call with shore counties and shore mayors, and each municipality, in fact, has its own uniqueness, even within New Jersey. But to be as coordinated as we can on some of the big steps, to be in some kind of harmony, seems to us to make sense. So, we're spending a lot of time speaking with each other, and our teams are speaking with each other. In a perfect world, you'd like to be acting in a multi-state way as it relates to beaches, as an example. Listen, it's a huge economic driver for us, John. You know that. It's a huge sort of just a family, personal, it's an identity thing in New Jersey as it is in Delaware. And so we've promised that we'd give some guidance by the end of the week, this week, that would be effective, most likely on Memorial Day weekend. And I think it's going to be, and Governor Carney and I had this conversation earlier, if I had to predict what that looks like, and we're still baking it, at least inside of New Jersey we are, and I suspect all of our states are, it's going to be relatively high level. with discretion locally to execute. And my guess is it'll rip a page out of the playbook that we used when we opened county parks and state parks, which is emphasis on social distancing and emphasis on capacity. I think those will probably be the two big thematic elements to it. Again, keep away from each other and somehow find a way to work on capacities so that we have less density on the beach. And I would hope that we'd have some guidance on that. As I said, later this week, our teams across the states are talking. The most important ones for us are Delaware and New York, but the broader regional council all the way Connecticut, Rhode Island, Massachusetts also matter. I'm sure for Governor Carney, Maryland, it matters a lot for him. And I hope that we'll have news for folks again by the end of the week.
Got it. Governor Carney?
Yeah, John, and Governor Murphy is exactly right. The beaches are such an important part of our identity. It's the Jersey Shore and it's the Delaware beaches. My parents were from southeastern Pennsylvania, and if you were from that area, you went to the Jersey Shore. If you grew up in northern Delaware, as I did, you went to the Delaware beaches. And so we're getting a lot of pressure, as Governor Murphy said, to open as quickly as possible. We've got a Memorial Day weekend coming up, and that's a big starting point for the summer tourism season at our beaches and at the Jersey Shore. We would like to do things more in sync, but each, as Governor Murphy said, each community, each town here in Delaware is different as well. I've been on the phone this week with the town mayors, just picking their brains about what they're thinking. We have some broader things that we're doing at the state level. The state here in Delaware is responsible mostly for the coastline and the beaches themselves, and the towns have responsibility up to those beaches, and it varies from town to town. So we're looking at things to try to do this in a rolling reopening kind of way, to go back to that concept, to avoid the big crowds and big gatherings, as Governor Murphy said, in terms of the objective. How to accomplish that objective is really the art here, in trying to figure out, trying to keep it local, if you will, to folks who have homes in these beach communities in Delaware, to limit the access to the extent possible. Have to be careful about creating unintended consequences, where you might be less liberal with your restrictions on one beach than another. And so you create a place where a lot of people congregate. A lot of it is regulating people coming on and off the beach and boardwalk. Over in New Jersey, they have the beach tag system. We don't have that over here in Delaware. So that's a tool that's not really available to us. But the goals are the same, and that's to avoid the big crowds, to keep people separate when they're on the beach. We allow people on the beaches now as long as they're walking and running and exercising alone or with your spouse or your family. The challenge is going to be working with our beach towns and beach communities to do that over Memorial Day weekend, and then as we move into June.
Governor Carney, thank you very much. And now questions from Ashley Balcerzak. Again, questions that our readers have asked us. Ashley?
Thanks, John. I'll start with you, Governor Murphy. How do you envision travel between states in the region? Will out-of-state travelers have to quarantine? And is this something that you've discussed with your regional partners?
Yeah, we haven't had a quarantine in place for out-of-state travelers, Ashley. We do have a stay-at-home still, so we do want folks to remember that as we begin to open things up, we still want folks to, we're not out of the woods yet. And by the way, I would just add one comment to Governor Carney's very good thoughts on the summer. He mentioned into June, and I would just say, if the curves and the numbers keep progressing positively, what the shore looks like, what the Delaware beaches look like, I don't want to put words in his mouth, on Memorial Day, it may look very different on July 4th. That it's not just what it looks like when we open things up, but as we can hopefully progress together. But Ashley, I don't know that that's a route we're going to go in terms of quarantining. But I will say this, that a big rationale, John asked this earlier, behind the testing and contact tracing that we laid out today, and that ultimately we will do the similar for isolation, is to get at any new flare-ups, whether those flare-ups are coming within our own community or coming from folks who have traveled from what I would call lower common denominator states that didn't shut down as early or as hard or have opened up to much sooner than we have. So that's the way we hope to get at this. And if you have the sort of scaled testing that we're talking about and the scaled contact tracing with the community workforce, we think we can get at that. Time will tell, but we feel confident that that architecture is going to be sufficient to be able to snuff out any flare-ups that come up. And by the way, they'll inevitably come up. Let's not kid ourselves. If we bat 1,000 on reopening, we're going to get, just by the nature of this virus, we're going to get flare-ups. The question is not whether we'll get them. What are we going to do to identify them and then deal with them?
Thank you very much. Governor Carney, at least in New Jersey, we saw kind of a progression going down the state where all of the cases and hospitalizations were really concentrated up north and then moved down south, where we're now seeing more increases here. What do your models tell you about a next curve that's predicted to happen around flu season or as states around the region are considering reopening plans? And what is your state doing to prepare for what Governor Murphy said may be inevitable flare-ups or new curves?
Yeah, so let me first just mention one of the unique challenges that we have that I haven't read about in New Jersey. When you talk about agriculture, it is Delaware's #1 industry still in the lower part of our state. And when you talk about Delaware agriculture, you're basically talking about poultry. The family farmers in Sussex County are the growers. They send the chickens to the poultry plants to get processed and into to meat markets across the country and certainly in this region. We had a significant outbreak within the poultry worker community and the communities in which they live. And they live in small enclaves. We've got groups of Caucasian Americans, Haitian Creoles, and Latinos that form the bulk of that workforce. And they live in very densely populated communities on the edges of small towns in our lower part of our state. So when I saw the first positive cases coming out of those poultry plants, I knew it had the potential for a real challenge because of the close proximity with which those families live. I was one of 9 kids. There were 11 of us in a small house, so I know what it's like to try to social distance in a pretty tight, densely populated house. And so we did have what we expected. And so in the lower part of our state, the least populous county has the highest number of positive cases. They haven't had the hospitalizations because it's mostly a younger population, and they haven't had nearly the deaths. Those have occurred in the northern part of our state because of the nursing home issues and the fact that infections got into some of the nursing homes and spread like wildfire. But moving forward, our focus, just like Governor Murphy's, I think every governor in the country is going to be around standing up that really extensive testing, isolating, and contact tracing program to control the spread of the virus. It's not going to be the blunt instrument of a stay-at-home order, of a shelter-in-place order. It's going to be a sophisticated public health effort to identify those who are positive, and that means testing people who aren't symptomatic. Right now, we've basically just been testing people who are symptomatic, testing asymptomatic folks, tracing their contacts, testing them, isolating them as a way to prevent the spread. I think my biggest concern from the public health experts is the fall return of the flu season, having the potential of a rebound on COVID-19 with the flu season at the same time. That would be a pretty bad thing, I think.
Kind of going off of that, I want to pose a question to both of you. It looks increasingly likely that reopening is going to kind of take longer than maybe residents are thinking, and there may be this second wave. But aid plans, either at the state or federal level, are expiring soon. Can you kind of tell us, besides asking the federal government for help, what are different ways that you are helping people who are struggling because they don't have a paycheck, or business owners that cannot reopen? I'll start with you, Governor Murphy. Can you kind of tell me about aid opportunities that you're weighing?
Yeah. I mean, Ashley, there's no question this is not a light switch. John Carney mentioned this earlier. It is going to be, I like the phrase he uses, a rolling opening. And by the way, I said this a minute ago, and John referred to the fall season. You look at Germany, South Korea, Singapore, Wuhan itself, you're seeing flare-ups, and we're seeing it live and real. So this is not only going to take longer, but to your very good question, you could have another wave. Please God, it's not, as we say, we're taking ourselves through hell here. We don't want to have to do this twice, but we're better darn. Our sixth point in our road to recovery, by the way, is resiliency. To have the PPE, the ventilators, the beds, the protocols, the healthcare relief workers out of the bullpen, the medicines, whatever it might be. Listen, we're doing a lot for, we're still processing an unprecedented amount of unemployment insurance requests. If folks are frustrated because they haven't gone through, I don't blame them. I promise you, we have made enormous progress, but we're dealing with a 500-year flood, as my colleague, the Attorney General, would say. The EDA, the Economic Development Authority, has put a lot of programs out. But John has served as outstanding member of Congress. There is nothing that could take the place of federal money. And so that's a plea that I make every single day. I'm grateful for the CARES Act. I'm grateful for the interpretation of the use of that money. The Federal Reserve is a borrowing facility that it's put forward, which we will almost certainly want to partake in. But there is nothing that comes close to straight up federal cash assistance for states, small businesses, individuals, hospital systems, transit systems, education, whatever it might be. The federal government plays a unique existential role. They can print money. We can't. We need not just New Jersey and Delaware, and not just blue states, red and blue alike all over the country, need a big amount of federal assistance today. Senator Menendez and Senator Cassidy, a Republican in Louisiana, have put forward a great bill in the Senate. Speaker Pelosi unveiled a very large bill today with a big dose of exactly the sort of relief we're talking about. In my opinion, that's priority number one for us, other than getting the healthcare crisis to come to a closure, is to get that cash to come in directly to our states.
Thank you very much. And you, Governor Carney?
Yeah, Governor Murphy hit the nail on the head. It's just a simple fact of public finance. The states have to balance our budgets by law, and the federal government can borrow money. And that's why liquidity in a problem like this really is the responsibility of the federal government, both to get money into the economy, get money to those individuals who are unemployed and need it. And I know part of that is to help the individuals and their family. Part of it is to get liquidity and money circulated in the economy through people who will spend it directly. And states, as Governor Murphy alluded to, are going to be have been hit dramatically with a reduction in and lost revenue. And we can't borrow money to make it up. We can borrow for our capital programs, and we'll be doing some of that, as other states, I'm sure, will be doing. But ultimately, if you're talking about cash assistance, just replenishing our unemployment insurance funds is going to be a big burden. And the way we pay for that here in Delaware, I'm sure in New Jersey and other states, is by taxing businesses. And it's going to be a time where businesses are going to be struggling for revenue to stay alive and to pay their employees. So when you're talking about matters of liquidity like that, and the kind of assistance that people are going to need, it really is a matter of public finance, that it has to come from the federal government, just because states cannot borrow that money. And we've been hit, our revenues have been hit. And even the local governments. I was on a conference call with my mayors this morning, and they were complaining about all the lost revenue that they get from selling electricity because folks are not being required to pay their bills during this period in time.
Governor Carney and Governor Murphy, I know we're up against time. I want to thank you both for taking the time today and talking to us and to our audience. And I just wanted to ask each of you if you had a quick second, if anything you want to say to the people, especially those who are asking questions about unemployment, rent relief, and all the things that they're waiting on for help right now with coronavirus. Anything in closing, Governor Murphy?
Listen, first of all, John and Ashley, thank you for having us, and Governor Carney, thank you for being such a great partner and neighbor. I would say we understand the frustration, the impatience, the fact that we've all been cooped up. I promise you, if you're unemployed, you will get every single penny that's coming to you, including the federal piece. And there are a number of windows we've created. If you pay a mortgage, if you pay rent, if you are at the risk of being foreclosed, your insurance premiums. If this continues to go on, we're going to do everything we can to extend those windows. And I would say, keep the faith. This is working. It is painful as heck. We get that. This has never happened to any of us before. But the social distancing, the staying home, all the steps that folks have taken, it is working. We're paying an enormous price for that, particularly in loss of life and economic terms. But we will get through this. I just know this, and it may be hard to see right now, but we'll get through this and we'll be stronger than ever before.
And I just say the same thing, and that is to keep the faith. This is working. It's taken an incredible price tag, both economically, personally. In Delaware, we like to think of ourselves as a state of neighbors. And neighbors look after one another. They know one another. They care about one another. And I think as a country, we need to think of ourselves as a country of neighbors where we do that. We take care of one another, certainly in this region. My friends, Governor Murphy, Governor Wolf, and Governor Hogan here in the Middle Atlantic region, New Jersey, Pennsylvania, and Maryland and Delaware, we're certainly doing our best to work together, to act like neighbors, to treat each other like neighbors. And I think if we do that, if all of our citizens do that, then we're going to get through this and we'll be stronger than ever. I was in a meeting of one of our economic development groups yesterday. And just out of the blue at the end, a guy spoke up and said, I couldn't be more optimistic about our future and our country. And to say that at a time like this was amazing, so inspirational for all of us. And that would be my message to my friends across the river in New Jersey and to all of our neighbors around the country.
Hear, hear.
Governor Carney, thank you. Governor Murphy, again, thank you. On behalf of my colleague, Ashley Balcerzak, and the rest of us here at the USA Today Network, thank you for watching and stay in touch.